Thanks, ma'am.
And this is what my expectations would be. Slide 1, it should just be a covered slide, title slide, straight from that title page of the clinical inquiry paper that you turned in. With a couple caveats. The title shouldn't be a question, so it should be related to your topic, but in kind of a statement. I used as an example for everything that I did today, the example article that was posted about should mild hypertension in pregnancy be treated. It's posted on the master's page. So for the title, I would use hypertension in pregnancy. That's it. Sweet, short, simple. And it needs to be in title case. Title case is the regular capitalizations schema. So if the is in the body of the title, it's lowercase. If it's the first word, it's uppercase. That's what title case means. Your name, I mean, the rest of this is pretty self-explanatory. Oops. Your second slide, the first official slide, because the title slide doesn't count. Yes?
Is this on the master's thesis page?
It is now. I put it there about an hour ago. So the question is, should medications be prescribed in mild hypertension and pregnancy? So that first slide, dump your actual clinical inquiry question on that slide. And you know how you guys hate super busy slides with a lot of bullets?
Yeah.
Yeah, so do we when you're presenting this. So this is on there, and you're going to have some talking points. What can you say just about the question? Well, you can say, why did you find it interesting? What about this topic made you choose it? How many people are affected by it? Worldwide, US? Why is it important to you, to anybody? And how does it relate to primary care? Some people get really wrapped up about, oh, this must be a primary care topic. But if you do it right, you can relate just about anything to primary care. Okay, so if you were looking at open versus minimally invasive lumbar spine surgery, how could that relate to primary care? Follow-up. I have a patient that had that procedure. I have a patient that's asking me about that procedure. So you can relate just about anything back to primary care, because primary care sees and does it all. You should probably take a couple minutes explaining this. How long is your whole presentation supposed to take?
3 to 7?
Yeah, about 7-ish. Have I seen anybody get docked for going over? No. But I am going to share with you where people do get crucified, especially by our DSC instructors. Because they enjoy doing it. I mean, no they don't, they're wonderful. I love them. Your next slide should be your evidence-based answer. So what did the article show? What did the body of your article show? Did you find support for your idea or not? And the sort recommendation, remember that? The sort thing?
Yes.
Yeah. For this article, it was B. And I'll explain why. Sources. What kind of articles did you use? Were they RCTs, cohort studies, retrospective studies, animal studies, meta-analyses, systematic reviews? What's the best evidence?
Randomized controlled trials.
Meta-analysis. Why? So, if you have a bunch of if you have a bunch of randomized control trials, someone can compile those into a systematic review. When there's enough of those, then you're going to see multiple systematic reviews. Then you can compile those. So you're increasing the quality of your data by magnitudes with those. So if you have a RCT of 1,000 participants, you have 10 of them, and it's covered in a systematic review, now you're looking at 10,000 patients. If you're looking at a meta-analysis that pooled multiple systematic reviews, you could easily have 100,000 for your N, and that makes much, much better data. Did you get that in freshman semester? Okay. Vague memory. Then your evidence summary slide. The faculty is pretty simple. We like pictures. And it's an easy way to compile your data. So for this particular article piece, if you go back to the source document, I made the table, and then I was filling it in, and my intent was they used 4 articles, and I was going to use 4 articles on the evidence summary, and then I noticed something. Articles 2 through 4 only reference this one article. That was the extent. So I sat there for a moment and said, well, this is the only thing that belongs on that data table. Anybody remember what N is?
Number of participants.
Number of participants, absolutely. So if you just make a simple table like this, it gets really easy to be able to talk about the data. What could I say about this? Well, what I just said, the other articles all reference this. This study did support using antihypertensives in mild hypertension in pregnancies. Now, the statistics. This is where people get tripped up, and this is where the DSCs have the most fun. Do you know what they mean? So I pulled this straight from the article, and the adjusted risk ratio, that's a tricky one. Adjusted risk ratios are based on linear regressions. I could spend 4 hours talking about just that. If you don't know what it is and you look it up and you still can't briefly summarize it, don't include it. All you gotta do is delete risk ratio, that's it. You still have good statistics because you have a P and you have a confidence interval. What can we say about the P and the confidence interval?
That's
Good, 'cause it's-
significant.
Yeah.
P less than 0.5.
Yeah, and the confidence interval is pretty tight, so that's acceptable. Number needed to treat, do we know what that was?
That's how many people you treat to have a positive significant.
Yes. In this case, it was 15. Not great. Ideally, what we're looking for with number needed to treat is 1. So this is meh. All right. What's the risk of just using one study?
You never
To
know
make
who
policy.
Paid, you don't know who paid for it.
You don't know who paid for it, and it hasn't been reproduced. So that's a problem. And, you know, if you want to show that you really understand this whole thing, you can say it was one study, the other articles all reference this one. I would feel better if there were multiple studies that reproduce this result. Just saying that tells us you understand the whole research process, and it makes you less of a target. If you open up by going, I think that's a good P, they'll jump in and dogpile. It's not good. So if you use a statistic, know what it means. Real simple. Okay. Come on. This is that whole sort thing. Why was this study B? Because the recommendations were based on limited evidence, one trial. That's why it's a B. I don't think you could make a case for C, but definitely a B. Now, the articles that based their recommendations on this single article, I would give them a C as far as sort, because they did very limited research. And then your last slide is the recommendations from others. That's it. It could be, what did the literature spawn? And in this case, 3 different organizations used the research results to create guidelines, but one of them used it to make specific recommendations. That's it. Nothing fancy. References. Just throw your references on the closing slides. Title and references don't count for total length. That's it. This is an introductory level project. The whole clinical inquiry thing is supposed to be the easiest thing that we could find to do a capstone project in phase 1. The biggest problem I see with students with the CI is they try to make it too complicated. Keep it simple. Questions?
Our minimum time is it 5 to 9 minutes?
5 minutes.
5 minutes is the minimum?
Yeah.
Okay.
Which, yes?
Who are we presenting it to?
A panel of 2 to 3 faculty members.
And do we all have the same faculty members or? Yeah.
Nah, it's pretty random.
I would hope so.
We try not to put all the sharpshooters on one panel, because then we get one panel with much lower grades than the others. So if you have 3 faculty, each will independently grade you on the rubric, which is posted, and then the score is averaged. And we did that to mitigate the hard asses with the softies.
For the one Russian judge?
Yeah, exactly. Yes,
Should we expect them to ask a bunch of questions about our research plan or no?
about your what?
The research that we did or no?
They might.
Okay.
The most common questions I've seen, why did you pick this topic? If you didn't say that, did you have any trouble with your research? Like, if you only ended up finding just a few articles and one of them was an animal study, you might want to say something about that, because what do we think about animal research? But some of the topics that I've seen, some of them were pretty new and there just wasn't a lot of research. So they, that might have forced the student to use an animal study. And if you say that, that will cut down on the questions, because they can definitely come back at you with that. The biggest thing I've seen is the statistics. And some of our more research savvy faculty getting really hung up on the details with the statistics. That's it. It's not hard.
I didn't know.
What was the date that we're supposed to present? Like,
Shoot.
I have it, let me look.
On tomorrow, I'm gonna ping the whole faculty with, you guys need to finish grading
Yeah.
the papers by COB Friday.
we're talking about grading the clinical history.
Mhm.
Yeah, because some people's
Yeah.
got turned in only like a week ago, and
Yep.
so now they have a short turnaround.
Was I missing something for the actual presentation? Because I didn't see it on here. When we have to present
I
our oral
think it's,
presentation?
I think it's March 11th. Let me triple check.
Yeah, it's coming.
It's coming up fast.
Yeah.
And I'm not quite as bold
Yeah,
as
it's March
said.
11th.
Where's that PowerPoint?
So then when do we have to submit it on Canvas? Because